Hello, everyone. I'm Dr. Mary Clifton. I'm an internal medicine doctor and the CEO and founder of CBD and CannabisInfo.com. I'm an expert in CBD and cannabis and its application in various clinical situations. I can't tell you how to grow it. I don't know how often it needs to be watered. I don't know how to process it, but I know and have read virtually every research study that has been conducted on CBD and cannabis. And I am particularly familiarized with CBD and cannabis and cancer diagnoses. So today we're going to talk a little bit about the different studies that have been done that have looked at CBD and cannabis and how they may help you with your cancer treatment and with the symptoms, and also how to choose and use the proper products. And then if you need any additional help, you can reach out to me anytime at cbdandcannabisinfo.com. All of the emails that are received through that site come directly to my email inbox. So I'll be able to email you right back, and I answer each one individually myself. So I want to start out with a 2019 study that was published involving Mayo providers. A total of 62 Mayo providers responded to the study request. Over half of them believed that cannabis is in fact a legitimate medication, but only 1 in 3 providers said they would ever offer it as a suggestion for their patients. Several of them, 1 in 3 again, worried about drug interactions with other medications that the patient might be taking, and were concerned that they didn't have enough information and enough knowledge to adequately make recommendations for CBD and cannabis for their patients. They also had concerns that they didn't really want to answer questions. Again, probably because there's just a limited amount of education in some of these communities on how to properly choose and use products, and then how to modify the products as time passes. It really seems like in the cannabis community, and particularly in cannabis surrounding cancer, that there are 2 positions. There's a position of affirmation that it's a powerful plant, useful everywhere, and it doesn't seem to be based in any particular fact or research. This position is irrespective of any scientific data. And there's a second position that is conservative and prejudiced and biased, that nobody benefits from cannabis, concerning that it's a gateway drug, or that it's a drug that could lead to a use of other drugs, or could be masking other things that are going to limit the person's ability to get completely better. There's all kinds of prejudices that have been sustained over the years around cannabis. But what we really need is a third approach. We need an approach that's based in peer-reviewed scientific research, and that's based in knowledge and in spreading the right information so that we can help people make the very best choices. And that has been the idea behind all of my work in CBD and cannabis. People can get cannabinoids from 3 different sources. There's the endocannabinoids that your body naturally makes on your own. Your body has a naturally occurring CBD, which is called anandamide. And there's also a less commonly known one, 2-AG, that is also developed within your body. And those are your body's naturally occurring CBDs. Your body regulates the amounts of anandamide and 2-AG in response to stress and inflammation to restore balance and homeostasis. There's also phytocannabinoids. These are the cannabinoids that are obtained from the cannabis or hemp plants. Cannabis plants tend to concentrate THC, and hemp plants tend to concentrate CBD and other cannabinoids. But the hemp plant and the cannabis plants are both the same plant. They're both cannabis sativa, but different plants concentrate different things. And so they're grown for different purposes. And you can also get your cannabinoids from synthetics. There are a few laboratories and pharmaceutical companies around the world who have worked to create CBDs that are pharmaceutical grade and CBD THC combinations that have been used in cancer patients and also in other diseases like multiple sclerosis. In studies around the world, and in petri dishes and laboratories everywhere, CB1 receptor stimulation, I should say, has been shown to improve analgesia, to control pain, and also to reduce emesis or nausea. So the receptors in our body are divided into CB1 and CB2 receptors primarily. The CB1 receptors are located primarily in the central nervous system, and CB2 receptors are located in all of the other organs throughout the body. There's also some CB3, CB4, CB5, but those receptors are rare and located in small locations within the brain and probably are not relevant for most day-to-day conversations about CBD and cannabis. But the CB1 receptor stimulation is notable for decreasing pain and decreasing nausea in several studies. And stimulation of the CB2 receptors, which are located primarily in the immune system, but are also located in all of the other tissues and organs in the body, that helps to reduce inflammation and improve the immune system response. So it seems a little unbelievable that we have CB receptors in all the organs in the body, and that when you consume cannabinoids like CBD or THC, that you're going to stimulate and impact every organ in your body. But the endocannabinoid system operates just like the other systems that you're already used to that have effects all over your body. For example, the thyroid system, where the hypothalamus talks to the pituitary gland at the base of the brain and then talks to the thyroid gland. That system is a system that, when it is operating properly, impacts every cell in the body in a positive way. But when it's operating negatively or improperly, you have an impact on literally every cell throughout the body. And the same is true with the cortisol system, where the adrenal glands increase or decrease the cortisol in response to stress and anxiety or fear or pain. And that cortisol level has an impact on every single other cell in the body. So the endocannabinoid system, the ECS, has a similar impact on the body, where every single cell is responding to CBD or THC that's being ingested, and working and using those molecules and to be able to restore balance and homeostasis in the setting of stress or pain or imbalance, literally anywhere. The body's naturally occurring endocannabinoids, the anandamide and the 2-AG, the CBD that the body naturally produces, those levels go up and down across the body just based on your needs. If we take a sample of fluid from a swollen knee, we can find an elevated amount of anandamide and 2-AG in that fluid. If we take a biopsy of a inflamed gut and put that under the microscope and test it for CB1 or CB2 receptors, we'll find that the body has actually upregulated the receptors in that inflamed area of bowel. The body is using the receptors and using the naturally occurring CBDs to help to regulate and control these symptoms. There's also some important enzymes you need to know about that hopefully in the near future we'll be able to measure to give you better ideas of exactly how your body is responding to using cannabinoids. The fatty acid amine hydrolase, or FAH, is important in breaking down anandamide, and also the monoacyl glycerol lipase. I have to check my notes when I read these really vague enzymatic words. That helps to break down 2-AG. So there's different products, different enzymes throughout the body that are helping to break down and cannabinoids and remove them from the body. And so that's part of the reason why some people might need more or some people might be less, because the CB1 and CB2 receptors have to some degree a genetic component, and these enzyme levels have a genetic component too. So one person may get little or no response to using cannabinoids while another one has a huge response. Someone might have a response that doesn't last for very long and they have to take a lot more medicine. And in another case, somebody might have a very long lasting response with just a little bit of medicine. Generally, across all of these fantastic studies that have been done around the world on CBD and cannabis and cancer show that the therapy is well tolerated. And in addition to managing symptoms, which we'll cover later in my talk, these cannabinoids, CBD, THC, and the other cannabinoids, there's like 142 I've heard, CBN, CBG, CBC, some of the big heavy hitters in that crowd. All of these cannabinoids have the potential to express anti-tumor activity. The cancer cells are interesting within the cannabinoid community because cancer cells overexpress CB1 and CB2 receptors. I mean to say that there are more CB receptors on cancer cells than there are on other tissues and organs throughout the body. So it's reasonable to assume that CBD and THC are going to have impacts on cancer cells. And I want to talk to you about all of the different ways that these products could impact the way that your cancer cells are responding to cancer. There's a general concept about cancer cells that we want to think about before we start to think about how these could individually be impacting cancer. And the biggest thought is to think about cancer cells as being immortal. We've all heard about the immortal life of Henrietta, that book, I can't remember the full title, where, you know, when we're looking at cancer cells in petri dishes, the cancer cell is behaving as an immortal cell. It doesn't kill itself. It doesn't move itself through a normal process where it lives for a period of time and then it dies and a new cell replaces it. And that's why cancer can be so effective at growing these big masses, because the cells just don't die. The only time they really die is when they outstrip the blood flow or they outstrip the nutrition that they can bring into the cancer growth. Helping a cancer cell to see itself as a normal cell that has to go through a normal lifestyle and then die is an important part of what cannabis does in terms of helping to fight cancer. Who is interested in this point at taking cannabis? And what type of person is looking to use cannabis to manage their cancer? In the Journal of Palliative Medicine, a study was published in 2019 of 816 cancer patients who were in treatment for their cancer at a palliative or a symptomatic care clinic. 1 in 5 of them tested positive for THC on a urine drug test. They tended to be younger and male and single, and also have a history of cigarette smoking, and interestingly have recently experienced radiotherapy or radiation therapy to treat their cancer. They reported that they got the most improvement from using cannabis as an addition to their chemotherapy for complaints of appetite, shortness of breath, fatigue, insomnia, and anxiety and depression. They found that they got excellent management of pain and nausea without significant side effects. And that would hold true with other studies. Nausea has been a major side effect or symptom of certain cancers that has responded very well to the administration of cannabis in several studies. And similarly, the effects of loss of appetite also respond well to high THC containing products. The users reported adverse effects of dizziness, dry mouth, sleepiness, and interestingly, nausea. So it points out, this list of adverse effects, that cannabis is not right for everyone. There will be some people who just don't like the way it feels, the sleepiness and dizziness and nausea. And for other people, it seems to work very well. And in my review of the literature, it's about 1 in 5. Repeatedly, study after study, somewhere between 17 and 21% of people are saying that it's just not for them. And that shakes out to about 1 in 20, 1 in 25. Sorry, 1 in 5 or 1 in 6, I mean. So if you're one of those persons who's tried this a couple of times and it's just not suiting you, you know, you don't have to keep trying it. There's other products available for you. But if you're one of the 4 in 5 who doesn't mind the way cannabis makes you feel, and maybe it even makes you feel better, it'll be a good thing to add to your current treatment armamentarium. It's important because some studies are showing that adding cannabis may help to improve your ability to fight cancer, but it also may help with all of the things that cancer brings with it: anxiety and insomnia, depression, nausea, loss of appetite. And so it's a very impressive list of side effects that actually get treated with cannabis. Instead of taking the cannabis and then having it create its whole own list of side effects that you have to subsequently deal with, this way you can use a product that's giving you a great treatment effect and is also giving you a really interesting supportive list of side effects. In one way, that there's several ways that cannabis can act as a cancer chemotherapy. And I want to start with a caveat here that we don't have data that is in large randomized controlled trials. This information on how cannabis might function as a chemotherapy to help shrink cancers and slow cancer growth, this is all Petri dish and test tube data in the laboratory. So we really don't know exactly how it's going to work in your body. We don't know if it will work, but it has some positive and very encouraging effects that are identified in the laboratory. In particular, there's its effect on the PGP pumps in the cells. PGP pumps are located in the cell membranes of your cells, and their job is to pump out toxins when they're presented with toxins that could be dangerous to the cell. The PGP pumps have the capacity to get smarter as they see toxins repeatedly and get better and better at removing toxins from your cells. The problem with that for a cancer patient is that you're going to see toxins repeatedly. They're going to continue to enter into the cell, and then you'll have to pump them out. The toxins being the chemotherapy. So with each exposure to chemotherapy, these toxic agents that are designed to help kill cancer cells, the cancer cell PGP pumps get increasingly smarter at pumping all of those toxins out of the cells. And then as it goes, they're getting smarter and smarter, and the chemotherapy becomes less and less effective, and your cancer becomes resistant to chemotherapy. What we have found in the test tube is that the addition of cannabis to that whole conglomeration of things, cancer cells and chemotherapy and effective PGP pumps, actually slows the efficiency of the PGP pumps. That allows the chemotherapy to stay inside the cancer cell for longer and help to more effectively kill the cancer cell. Another great way that cannabis could be working for you is through the MAPK pathway, and that's the mitogen activated protein kinase pathway. This is a pathway within all of your cells that helps growth, that is a signaling pathway for growth. And the MAPK pathway can function in a little bit of a disordered way with cancer cells because, as we've said before, cancer cells don't recognize that they should be dying. So the MAPK pathway can be stimulated in a way that will allow the cancer cell to recognize itself as a more normal cell, leading to cellular apoptosis and cell death. So the MAPK pathway is another important place where cancer cells can be sort of restored to a more normal cellular function with the addition of cannabis. Similarly, the ceramides are a family of lipid molecules in the cell membrane that are responsible, again, for the cell to move toward cellular apoptosis and death. And when a CB2 receptor is stimulated, that leads to an increase in ceramide production and an increase in cell death. So these ceramides are found in multiple different types of cells, and again are going to be very important in guiding them in the right direction to help that cancer cell see itself as mortal and go away. Similarly, the reactive oxygen species. We all know about the reactive oxygen species. I mean, when you inhale and exhale, you inhale oxygen and you exhale carbon dioxide. That oxygen is an important part of the energy metabolism in your cells and a key byproduct of that energy metabolism is the reactive oxygen species, that sometimes you create these highly reactive oxygen radicals that will bind to cells and can cause problems. They're sort of the equivalent of the rust on your car, except it's rust on your DNA. And it can cause problems over time by making the DNA harder to replicate, by creating a situation where you might be in a position where you start to have problems with the cell not responding appropriately to that pressure from all of those oxygen radicals. It can actually, over time, damage the DNA to the point that it pops it into a cancer. So the cannabis's impact on the reactive oxygen species could also be extremely beneficial to helping that oxygen, reactive oxygen species stay lower and not have as much accumulated DNA damage over the lifetime. There's also TIMP1, which is tissue inhibitor of matrix metalloproteinase 1. This is an enzyme that degrades intracellular proteins and inhibits and creates cellular invasion. If a cancer needs to grow, like particularly bony metastases have a lot of proteinases that they secrete because they have to break down the area that they're trying to grow into, and then they can expand. So these metalloproteinases are stimulated by the cancer, but they can be inhibited by cannabis. And that will lead to a little bit more difficulty, a little bit more complexity for the cancer to be able to have some space to grow into. Another really effective way that cannabis may be inhibiting cellular invasion of tissues and preventing that exponential growth of cancers. So the CB1 and CB2 receptors are found on tumors in high concentrations. And it also appears that that stimulation of these receptors will modulate stem cell growth. It's important to be able to modulate stem cell growth, activate your stem cells to bring new healthy cells into fruition in whatever area they need. Because stem cells are what we refer to as pluripotential cells. They're cells that once activated, they can do whatever they like. They can become an eyeball, or they can become a skin cell, or they can become a liver. So it's very helpful to be able to stimulate stem cells and help them to replace an organ that's being affected by cancer with some healthy, nourished, fresh, brand new cells that are ready to do the activities that are needed to keep your body running. So the fact that the CBD or cannabis could activate and modulate stem cell growth is also very exciting. There's also the symptoms of cancer that are particularly troublesome. And oftentimes, we say that it's not really the cancer that is killing the individual in a lot of cases. It's the loss of appetite. It's the, never-ending nausea that limits people's ability to eat or drink. And so it's the dehydration or the malnutrition that contributes mostly to the end of life instead of the cancer being the primary problem. But these symptoms of a loss of appetite and nausea have been studied in several studies. But my favorite study was one of 42 patients who were followed for 6 weeks on Dronabinol, which is a synthetic cannabinoid. These people experienced an increased appetite and a reduced rate of weight loss. Another study compared synthetic cannabinoids to steroids, medroxyprogesterone, which is used frequently to stimulate the appetite of people with cancer, but has some pretty significant consequences, particularly in long-term cortisol production and in the adrenal gland effects, but it can also affect skin and muscle and sleep. It has a wide variety of effects across the body. But this particular study compared steroids to cannabinoids and found that patients who used cannabinoids had less side effects, and 50% of patients who were treated with cannabinoids experienced improvement after their treatment by using the cannabis so instead of the steroid. So the cannabis is very effective for people who are experiencing nausea and loss of appetite due to cancer chemotherapy. Pain is also a serious problem that impacts a lot of people who are suffering from cancer. And other people who don't have cancer also deal with pain. 25 million adults around the United States deal with chronic cancer pain, and many millions more deal with chronic back pain, knee pain, elbow and shoulder pain, all of the muscle aches and pains that are associated with time passing and all of us getting a little bit older. All of these pain pathways, whether it's a weekend warrior syndrome from playing basketball really hard and having a great weekend and having sore knees on Monday and Tuesday, or whether it's a fibromyalgia or interstitial cystitis, chronic low back pain, inflammatory or irritable bowel diseases, all of those chronic pain promoters also can cause a painful stimuli to be transversing to the brain through the spinal cord. All of these different pain syndromes have very similar mechanisms. And so the management of pain falls into pretty similar pathways, especially when the pain becomes chronic and we've really depleted the pain pathways' normal mechanisms of managing and controlling pain. The use of phytocannabinoids, the use of cannabis or CBD in this setting appears to have significant benefit. There have been 29 randomized controlled trials around the world and in our own country who have shown decreased pain in many, many situations with very limited side effects. So if there is chronic pain going on with cancer, it seems very reasonable to think about treating that pain with these products, and not only getting the pain treated, but also getting the symptoms of appetite and nausea better, and also giving yourself the opportunity to have some relief from the insomnia and anxiety that also plagues so many cancer patients. It's important to find a way to unwind. So the perceptions of cancer and the way that these products could help you with your cancer, we need to work hard to break through these stereotypes, because patients and physicians need to work together. 1 in 3 patients who is using cannabis during their cancer treatment don't tell their doctors that they're using this therapy. I want to encourage you to be very straightforward and upfront with your doctor, because some of the cannabis therapies do have interactions with certain medications, particularly with blood thinners that are often used when somebody with cancer experiences a blood clot and you get put on blood thinners. Though the levels of those can change with using cancer chemotherapy. And there's also issues with people who are using chemotherapy. You want to make sure that if you're using chemotherapy or blood thinners with your cannabis, that you notify your doctor. So if they need to make any adjustments, or they just simply need to be aware, then that will be helpful. There's 3/4 of doctors who think this is helpful for physical symptoms, and that's supported in the community. So it's important to continue to work against any ongoing prohibition or any ongoing stigma, and make these products available to everybody who is dealing with cancer so they can get their symptoms under control and get back to living a better life. Robust human studies are not available. And here's the thing, they're not going to be. We don't have a product here that has a single valuable chemical in it. If we're working with the FDA to create a large randomized controlled trial in multiple sites of 10 or 20,000 people to see if these products work, you have to have one molecule or maybe 2. The FDA doesn't know how to handle a whole plant where there's terpenes, where there's CBD and THC, but there might be some CBN or CBG or CBC. The FDA just doesn't know what to do with a product like that. They can't study it in their current study model. Plus you have, as I said, all the terpenes. You've got the limonene and pinene and linalool and beta-caryophyllene, all kinds of recognized terpenes that can be mixed together in a cannabis plant in a way that provides a superior product, a product that has a higher level of efficacy for you. But if you don't take all those factors into effect, you don't know which one is causing the outcome. The FDA wants to look at one molecule and apply one molecule and then see if they got an outcome from the application of that one molecule. But if you're using cannabis, you're going to be applying maybe 130 different molecules. And it may be in your particular circumstance that one certain terpene combined with one certain cannabinoid is going to be superior for you. We just don't have enough information to know that yet. We know a little bit from petri dishes and test tubes, but over and over again, the science has shown that what's going on in the laboratory looks different once it actually goes into a human model. We do, however, have so many terrific success stories. For example, I have a family member in my extended family who had a 6-month prognosis for lung cancer, a small cell lung cancer. And his wife did everything for him. It was really beautiful. She got rid of the scented candles in their home. She changed their diet. She did all kinds of things. And then she came home one day and said, I think you need to start smoking highly concentrated cannabis products and start using the Rick Simpson oil. I really think you need to do that every single day. And her husband said, well, if nothing else, at least I'll have a really happy last 6 months on earth. And then do you know what happened? His cancer is completely gone. And it's been 6 years. That is, I think, one of the most remarkable cancer stories I've heard with all of the work I've done. But I've heard other less remarkable and still amazing stories from so many people that I think it's reasonable to consider cannabinoids in addition to your chemotherapy for all of the reasons that we've already stated. There's all of the effects of the entourage effect where you get benefits from everything that you're getting from this whole plant. And it's worth making a good choice. So I want to move now to choosing and using a cannabinoid product for managing your cancer. I also want to state before we get started that there really isn't anybody, I'm sure there's somebody, but there really isn't anybody who is respected within either the cannabis community or the medical community who would say that you should stop doing everything that you're doing with chemotherapy and manage a cancer exclusively with cannabinoids. We do not have any research that supports that stopping everything else and working exclusively with cannabis is going to help you to get your cancer under control and lead you to a point of cure or of remission. You should be considering using the cannabis in combination with the Western medical model for the very best potential outcomes. So when you're choosing and using your cancer chemotherapy or using cannabis and CBD within cancer chemotherapy, you just want to think about this whole person that you are and how you naturally work and how your body naturally leans. There are some types of cannabis. We'll start with cannabis. There are some types of cannabis that are more stimulating than other types. Like a sativa is more stimulating, while an indica will leave you indicouch, leave you like relaxed and sometimes almost with that psychomotor limitations to where you're not even really wanting to get up and move. So the different types of cannabinoids can have different impacts on your level of energy. So having a product that creates you have to just know how your body is. If you're a person who has a difficult time getting up and getting your activities done as it is, you certainly don't want to give yourself a product that's going to make you even more fatigued. But if you're a person who runs around a lot and you need to rest, that might not be such a big thing to take a product that is more of an indica strain, like an indica hybrid, to give you a bit more relaxation. These plants too are indica and sativa hybrids. You know, a different cannabis plant is going to lean more toward indica or lean more toward a sativa. It's hard to find a really pure sativa or a pure indica anymore, but they lean in that direction, and with the recognition that a plant that has been living on the continent of Africa its whole life and is an indica may be giving you a different experience than a plant that has, you know, been living in South America for its whole life. So all indicas are not created equal. All sativas are not created equal. But when you go to the dispensary or when you work with one of my coaches, you can talk through what products are available to you and select a product that is going to lean more in the direction of providing what you need it to provide. This idea of sedation versus enhancing activity is one significant part of picking the right cannabis. But another thing that's important to think about is your general level of anxiety or depression or mood destabilization at all. If you tend to be an anxious person, you tend to like trend toward more anxiety, you're going to want to consider staying away from the sativas, because sometimes a sativa, a high THC sativa in particular, if you're working on managing nausea and appetite, is going to give you problems with a higher level of anxiety in certain circumstances. So if you're a person who's already highly anxious and then you bring on a product that will stimulate your anxiety, then you're going to find yourself maybe not enjoying the experience and not wanting to do it again. So it's really helpful to think about the sativa and indica also in terms of how much anxiety you have, or if you're trending toward a depression. If you're the kind of person who gets very depressed and tearful, then maybe a sativa is going to be a little better for you. Used carefully, you'll probably be able to control any anxiety that might surface, and it'll give you a little added energy and a little boost and a little bit more focus and awareness, so that maybe the depression can be set off to the side. So those are two of the things that I really like to think about when I'm selecting a cannabis for patients. How much energy do you want to have? How much energy do you want to stimulate? And also, how much anxiety and depression are you dealing with? That'll really drive a lot of the decisions that I'm making. Often when you're dealing with nausea or anorexia, which is not anorexia nervosa, like people who don't eat, but anorexia, the loss of appetite that's just associated with disease. So if you're dealing with nausea and anorexia, oftentimes a high THC product is a really good product to use. The loss of appetite and the nausea that's associated with cancer is generally considered to be supratentorial. It's mostly in the brain. It's not that there's something going on with the stomach or that there's lymph node enlargement that's pushing against the esophagus or anything like that. It seems like something within the cancer or within the enteroendocrine system, like the CCK and the ghrelin and the leptin, get thrown off, and people feel full or they feel nauseated, and it doesn't have any basis in how they actually feel or what's actually going on in their gut. So they may not have eaten for several days, but the thought of food might make them feel very uncomfortable. And that's probably an enteroendocrine system thing. Hopefully we can figure out those hormones and be even more specific and direct in our approach to handling this nausea and anorexia. But most of that is going through the vagus nerve, which you recognize as the superhighway between the gut and the brain. You know, the enteroendocrine system, the microbiome is sending that data up to the brain, and then the brain is responding to that by the anorexia and nausea. So using a high THC product that's appropriately formulated for your level of anxiety and energy is going to be the most beneficial for getting those symptoms under control. We don't have in medicine a lot of positions for the high THC products within the cannabis, all of the cultivars, all of the different strains. But these high THC products seem to be, in particular, very effective when you're dealing with the side effects of not being able to eat and of being nauseated with cancer. And similarly, if you're dealing with severe pain, oftentimes if you have mild pain from, overexertion, from a weekend warrior syndrome, or from whatever, if you just got a bum knee that acts up now and then, that pain is significant, but it will oftentimes respond to just a little well-placed CBD. But the pain that you're dealing with when you've got cancer, this chronic pain that really is significant and persistent, responds also very well to these high THC products. So you just want to make sure to look at all the products that you have available, and when you're getting ready to talk to a coach about how to use these products, that you know what's available to you and know what your percentages and ratios are. And your coach should be able to help you with some good advice within the cancer realm for sometimes a higher THC product. And then in addition to considering like your product selection, you also want to think about your mode of administration. With the mode of administration, I like to have a product that works more long-term and something that also works a little more short-term. When I first start working with people, I try to make sure that everybody has something that has a rapid onset, a mode of administration, because you want to know if it's working. So try using a product where you can take the product on and get a 1 to 2 minute result, like an inhalation method. I have here with me a hemp cigarette. This isn't cannabis, even though it looks like it and it smells like it, but it's a pre-rolled 100% hemp product. So, a very trace amount of THC, but it has all the CBD and all of the other products that go with a hemp product. So it's a CBD delivery system that onset of action is like instantaneous, 60 to 90 seconds. Now you can also get your products in tinctures. And if you hold these tinctures under your tongue, you can expect to get an onset in 8 or 9 minutes. But if you swallow the tincture, it turns it into an edible. And then your onset of action is more like 60 to 90 minutes. So a lot of the tablets and gummy bears and other edibles like cookies and things, or a tincture that you just swallow, is going to take, that 60 to 90 minutes to have its effect. This is just an oil. Oftentimes it's a coconut oil. Sometimes it's olive oil or some other, very light, tasteless oil that you can use to help to get benefits more rapidly or in a more sustained way, depending on how it's ingested. There's all kinds of other, there's all kinds of, like, for example, skin patches that you can wear if you want to get your products transdermally delivered. There's a couple of, there's an inhaler that I've seen. There's some sweet tarts that I've seen. But the majority of my patients are either using a tincture or they're using a cigarette, either a cannabis or a hemp cigarette. I really like having these inhalational products available for immediate results, for managing cancer pain, anxiety, for people who are having difficulty falling asleep. If you have a bout of nausea that you're having difficulty controlling, these are so helpful to break through that type of symptom and get people on the mend much quicker so that you can get back to your everyday life. So it's fun to figure out what is the proper dose on your regular use of your elixir or your oil-based delivery system. And it's also a great idea to have an inhalational product for breakthrough. Smoking cannabis is totally different than smoking cigarettes. So the risk of the smoke is completely different. When you're smoking cigarettes and you're doing 240 inhalations a day of a very inflammatory product, you are going to see some responses to that inflammation in the lungs. Studies, however, have shown that people who are using cannabinoid products over their lifetime don't actually have any worsened lung conditions, and in some cases their lungs appear to be in better shape than people who aren't using cannabis. We think that's because you're not inhaling 240 times a day, you're inhaling 1 or 2 times a day, or maybe 3 or 4 if you're a heavy user. And those inhalations are anti-inflammatory rather than pro-inflammatory. In fact, there's a research study going on now where tobacco companies are combining CBD with tobacco products to try to decrease the inflammation associated with tobacco use. So there's value in these products for cannabinoid management, all of these different products. I would just advise you to be careful with using an edible if you've never used cannabis before. A lot of people get into an edible because it seems harmless. I mean, what could a gummy bear do wrong? But the problem is that gummy bears and other edibles have these onset of actions that are delayed and unreliable. So you may take a gummy bear and think that you're about to get, a result, and then 60 to 90 minutes later, you're still waiting for the result, and then it comes on, and you don't really have any control over it. So it may come on a lot harder and faster than you expected. It may come on slow and a little, anxiety provoking. So you just have to approach those with caution. Alternately, if you're smoking, you take an inhalation, you get a response in 2 minutes, it peaks in 7 minutes, 7 to 9 minutes. You can decide if that is enough or if you think you need to take another inhalation. And then you can say, you know what, on most days I need 2 inhalations. Some days I need 1. When my stomach is empty, I need 1. When I'm full, I need 3. You can figure out how much you need and adjust accordingly so that you have your symptoms under excellent control with these products. That's the basics of choosing and using, but I should probably spend just a minute talking to you about CBD. We have several CBD products that I recommend on my site because there's several excellent products on the market. But the best way to think about your CBD is to look for somebody who's doing third-party testing on their products, and look for a CBD that smells fantastic. If it smells good to you, it's probably going to fit into the terrain of your body really well. Some CBDs almost smell like fuel or diesel to me. And then some CBDs have this really luscious green smell with like a citrusy background that I just love. And oftentimes that cultivar is going to be a cultivar that you really like. And if it smells good to you, it's going to be something that you're actually going to take because you have to get it in your body in order for it to work. And I feel the same way when you're choosing your pre-rolls. These CBD pre-rolls smell fantastic. There's, again, just a little citrus background, but also that wonderful green smell to it that's very, very appealing. And so give your new products a whiff if you can. Oftentimes at the dispensary, the worker will offer you the container, and you can sort of waft it towards yourself to see if it's something that appeals to you. And it's important if it does. That's a really good sign that you're on the right track and that you're working with somebody who's doing a good job of helping you select really great products. But if you're still having some concerns about picking out CBD, we can talk about specific products at my site with myself or one of my coaches. We're all available for consultation anytime. Or if you if you just don't have any product ideas at all, you can sign up for my newsletter. I feature a CBD on virtually every newsletter that I love and that I know the owners, and I've seen the way that they're manufacturing, and I can assure you that they're doing a good job. But a lot of CBDs will have third-party testing to where you can actually look at the bottle, or you can look at the packaging and just see, usually, with the SKU on the bottom or with a QR code that's often present on the bottom. You can run like those codes, and then it'll pull up on your phone all of their testing. So you can make sure that they're doing a good job of assuring you that they have no heavy metals, no not a high level of insecticides or pesticides, and that their concentrations of CBD and THC are accurate and appropriate for distribution across the public. I hope that I have given you a decent overview and answered several of your questions for how to use and choose CBD and cannabis and why you would consider using these products to help you along your cancer journey. I am excited to talk to you. If you have any further questions, you can reach out to me sincerely anytime at cbdandcannabisinfo.com. Remember that in many cases, people within the cancer community and people within the cannabis community believe that the entourage effect is a very effective way to get these products. You can isolate down certain products, certain molecules, but I think that there is a divine intention to have provided our bodies with a endocannabinoid system, a system that we can stimulate with phytocannabinoids, and then to provide us with whole plants that flower and grow with really very little work. I mean, they're basically weeds. So if you can find a whole bud that's giving you the THC and CBD concentrations you need, that has a terpene profile that looks like something that would suit you, then that's almost always the way to go, in my opinion, at least at this point where the scientific research is. That will give you the entourage effect. It'll not only give you the CBD and the THC, but it'll also give you a little CBN and CBG and CBC, and it'll give you some great terpenes. It's a whole plant. And that, in my mind, is always superior to a plant that has been reduced to a distillation of itself. There are different types of cancer cells. And before you go into a rabbit hole about your particular cancer cell and whether or not THC has a better effect or CBD has a better effect, I want to warn you again that all of these trials have been done in test tubes and petri dishes, and we really cannot expand that knowledge to be fact until we've completed larger human trials or more, at least administrative or dosing systems where we've been able to see what has worked for various people. In the meantime, choose a whole plant product and try to be assured that these products are going to be effective, and they're the way that nature intended to deliver all of these powerful plant chemicals to you. I also wanted to mention that there's been a few studies that have shown that cancer chemotherapy, especially cisplatin and doxorubicin, are known for inducing nerve and heart damage, and that nerve and heart damage can be mediated or eliminated with the administration of cannabis concurrently. So that's another interesting thing to do, that not only will it help to potentially kill the cancer and reduce the symptoms, but it may also reduce some of the long-term consequences, the cell damage that people see with cancer chemotherapy, particularly with cisplatin and doxorubicin. And remember too that there's oral versus inhaled versus skin patches versus, so many different modes of administration. It's a good idea to have something that's going to give you a longer lasting effect and something that's going to be available to you when you have breakthrough symptoms. And also, it's a good idea to think about memory. People do have some short-term memory impacts with smoking a lot of cannabis regularly, but those short-term memory impacts seem to go away in as little as 3 days. Earlier studies had suggested you need to discontinue cannabis for 3 months, but now it's clear that it's just 3 days and people should start to see improvements in their memory. So don't worry if you experience a little dip in your short-term memory. A discontinuation of the products for just a few days should help to significantly remedy that. And don't worry that it's a gateway to bigger and more ominous and more serious drugs. That's also been proven to be false. And in terms of reefer madness, having a psychotic break, experiencing suicidal ideation while you're high for the first time is exceedingly rare. It can happen though when you get high for the first time, or if you have a tendency, it can happen from getting high from anything. The studies that look at people who have been admitted to psychiatric units with their first psychotic break, that has been impacted by excessive alcohol use, by cocaine, by heroin, by bath salts, and by cannabis. So if you're a person who is already hearing things that are not there or seeing things that aren't there, if you have auditory or visual hallucinations, you shouldn't be using any drugs, and you should be talking to your doctor about what you are hearing and seeing that other people aren't hearing or seeing. But in the case of somebody with who can speak up for themselves and who can make their own decisions, and somebody with reasonably good intellect who isn't having a tendency towards psychosis, using these products to control all of these situations, conditions, and symptoms surrounding cancer may be a very good idea. Thank you for watching.